Teeth sensitivity can vary from the odd twinge or can be so severe as to really impact on a person's life. It's important not to ignore it. There are a number of causes which should be fully addressed with your dental team, and I'm going to focus on the sensitivity due to receding gums as a symptom of gum disease or a side effect in the treatment of gum disease, specifically periodontitis. Now, brushing too hard or with a hard toothbrush can cause trauma to the gum line, leading it to recede or shrink, exposing more of the tooth or the root beneath. Now, this new exposed bit of tooth can also wear down through traumatic brushing and acidic food or drinks. You should also take care with acidic foods and drinks such as carbonated drinks, citrus fruits, and many other things that you may not realize are acidic, and limit the frequency of consumption of these because more frequent intake is more damaging to the tooth surface compared to, for example, consuming in one sitting. The teeth have thin protective enamel layers, which get thinner around the neck of the teeth, close to the gum line. The second layer of the tooth is the sensitive dentine. And dentine is made up of microscopic tunnels, or tubules as we call them, and these tubules connect and communicate with the pulp at the center of the tooth which contains the nerves, to which transmission of sensations of pain occur. The thinning of the enamel, or exposure of the root dentine, can lead to sensitivity, and the symptoms of sensitivity usually last a few seconds after the stimulus has been removed. Periodontitis is a chronic inflammatory gum disease triggered by bacterial infection, and it leads to destruction and loss of the supporting gum and bone around your teeth. When severe, and if untreated, it can lead to tooth loss. The initial damage may not be visible, and the gums may shrink or recede only after the disease has become established or when it's more severe. Now, the more severe your periodontitis, the more we expect to see longer teeth or gaps between your teeth, and this in turn can lead to more sensitivity. Your gums can also recede and your teeth become sensitive as a direct result of periodontal treatment. Now, this can be managed, and it's important to see the positives of getting control of your gum disease through the treatment, which will fundamentally help you save your teeth. So how can we treat tooth sensitivity? You could use a desensitizing toothpaste. After several applications, this will gradually block the tubules or protect and strengthen the surface of the tooth, thereby blocking the stimulus which causes the pain. Ask your dental care professional which one might work best for you. Your dentist might also suggest the use of a prescription fluoride toothpaste for brushing, or for use in custom-made trays to be worn at home. Your dentist might apply a fluoride varnish or other topical desensitizing agents to the sensitive areas. This may require multiple applications over time, or it might provide quicker relief depending on your situation. And if appropriate, a filling or a resin material may be applied to a sensitive area. In some cases, a surgical gum graft procedure may be required. And although not always an option, if your tooth root has lost gum tissue, a small amount of gum tissue can be taken from elsewhere in your mouth and attached to the affected site. Now, this can cover and protect the exposed root dentine and reduce sensitivity. People often forget that plaque itself is a sticky bacterial film, which is also acidic in nature and can worsen sensitivity, so be sure to carefully remove it all. Finally, remember, teeth sensitivity can be a consequence of gum disease, and gum diseases are preventable. Be sure to have your gum health checked regularly and visit your dental team for more advice.